Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, the bill is finally introduced. The 117th Congress is now underway, and the Medicare Orthotic and Prosthetic Patient-Centered Care Act has been introduced in the House of Representatives. We want to congratulate the lead organization on this bill, AOPA. We've been working closely with AOPA along with the other alliance partners, BOC, ABC, and the Academy, to get the bill introduced. The Alliance strongly supports the bill, and AOP, of course, supports the bill, and will be sending a letter to that effect to the sponsors today in the House of Representatives. We'll also be asking you at the end of this video to take action of your own to try to get as many co-sponsors as possible. The bill number this year is a great number, HR 1990, easy to remember. First year I began doing lobbying and legislative work in Washington. Easy for me to remember. It's a great piece of legislation, the very same bill that was introduced in the last Congress. The bill does four main things. It would separate durable medical equipment from orthotics and prosthetics in the statute. That would allow the federal government to regulate orthotic and prosthetic care differently and to a greater extent than it currently is in the current law. That has all kinds of implications down the road, and it's something that we've been striving for as a field for some time. The second provision redefines the definition of off-the-shelf orthotics and would essentially change the CMS's interpretation of the term minimal self-adjustment, which would constrict the amount of off-the-shelf orthotics defined under the law, which are subject to competitive bidding. We believe that a lot of the orthotics that are potentially subject to competitive bidding under the definition as interpreted by CMS would restrict the ability to access clinical care associated with those orthoses. And so we are very strongly in favor of restoring original congressional intent and ensuring that minimal self-adjustment truly means adjustments by the individual, and the individual, him or herself. And so that would be a major aspect of this bill. The third provision would exempt orthotists and prosthetists from competitive bidding of OTS orthotics. That's an important provision as well. It would treat O&P practitioners similar to physicians and therapists who are currently exempted from competitive bidding. They can provide orthoses that are on the list of codes, and they bill at the competitive bidding amount. We are seeking the exact same treatment so that we don't need contracts with the federal government to provide off-the-shelf orthoses in the places around the country that are running that program. We feel that O&P practitioners are well trained and should have the flexibility to directly treat patients when they're in their office and not have to refer them to another provider that happens to have a contract when we're talking about OTS orthotics. And then finally, the law would ban drop shipping of any type of orthosis that is other than off the shelf as defined by the law. So it would prohibit shipping to a patient's home without clinical involvement, custom fit and custom fabricated orthoses and prostheses, by the way. Not that that's been a problem to date, but it would eliminate the ability of providers and manufacturers, I suppose, to drop ship any custom fit fabricated orthoses or prostheses to a patient's home. We think that's an important patient-centric patient protection. We believe that's something that's necessary for the Medicare program to do to reduce the amount of fraud, abuse, and waste in the orthotics and prosthetics benefit. And that has been witnessed by the Department of Justice investigations and other reports by the government in the past. So what can you do to help? Well, let me just restate that the O&P Alliance is sending up to Capitol Hill a letter today supporting the bill, thanking the sponsors. NAAOP will be reaching out to each member of those who participated in its December fly-in to Washington, virtual fly-in. We'll be touching base with all of those offices, that's dozens and dozens of offices, and seeking their co-sponsorship of this bill. And finally, we ask you, as NAAOP members and friends, to go to the NAAOP website at naaop.org. Click on the Legislative Congressional Action Center, and you'll be directed to draft an email, find your member of Congress, and submit a request for them to co-sponsor the legislation. We ask you to try to amend that template email so that it comes from you. You introduce yourself, make any arguments you feel should be made so that they're not all receiving the same exact letter. We would appreciate any support that you could provide. We're excited about the bill. We're looking forward to working hard to try to get this across the finish line this year. The bill is bipartisan. It was introduced by Mike Thompson of California, Glenn Thompson of Pennsylvania, Thompson twins we call them. And then on the Energy and Commerce Committee, it was introduced by Congressman Butterfield, a Democrat from North Carolina, and Congressman Guthrie, a Republican from Kentucky, who's in a senior position on healthcare issues. The bill's referred to two different committees, Energy and Commerce and Ways and Means, but that's typical for Medicare legislation. And we'll be working both committees to try to get that through. Stay tuned for the introduction of the Senate bill, which should come in several weeks. Thanks so very much.